Good morning, good afternoon, good evening, everyone. Welcome to you all to UNICEF's very special World Polio Day event to celebrate and honor women around the world who have been a part of this historic effort to eradicate polio. My name is Geeta Rao Gupta, and I'm currently a senior fellow at the UN Foundation in Washington, D.C., and a senior advisor to Co-Impact, a global collaborative philanthropy. I'm also a gender champion for the Global Polio Eradication Initiative, better known as GPEI, which means that I have committed to do my part in advancing gender equality in polio eradication. This is a very special event for me because it brings back to me the place and time when polio eradication was at a very significant turning point. Back in 2011, when I started serving as Deputy Executive Director at UNICEF, I was in charge of programs, there were 650 cases of polio globally. Today, at this moment in history, there are only 2 cases of the wild polio virus circulating in only 2 countries. That is an amazing achievement, and I'm very honored to have been a small part of that journey. There are so many people that have been involved in this historic effort, but through each phase and every year of this program, women have consistently been the thread that has woven together the fabric of this program. Today, we are here to honor these women and mobilize support for the amplification of gender equality that will be one of the key enabling factors to end polio for good. Not only have these women been a part of the polio eradication efforts, they have also stepped in during the COVID-19 emergency and have used all of their skills, know-how, and the platforms they have to educate communities on how to stay safe from this deadly virus. They have risked their own safety and dedicated their time to ensure that the children in their communities are safe and that families have the information that they need to be protected. So before I introduce our next speaker, I would just like to inform you all that there is a Q&A box that you can see on your screen. Please feel free to use it for questions, comments, and any feedback. It will not be visible to the participants now, but will give us an opportunity to hear your thoughts on the topics that we discuss and on the overall event. So please do actively use that Q&A function. So now, without further ado, I would like to hand it over to the gender champion for polio in UNICEF, UNICEF's fearless leader, Executive Director Henrietta Fore. Over to you, Edie Fore.
Thank you very much, Geeta. And Geeta, thank you for all the work you've done over the years, because this is an exciting moment in time for polio. So on behalf of UNICEF, welcome to this very special World Polio Day event on the role of women and on polio eradication. We are all gender champions, so thank you, Geeta, for being our moderator. The world continues to see broad progress in the fight against polio. The number of children affected by the polio virus has decreased by 99% over the past 3 decades. And last year, the Africa region was certified free of wild polio. And this year, as Geeta just said, in the last 2 remaining polio endemic countries of Afghanistan and Pakistan, only 2 wild polio cases have been reported so far. Behind this remarkable progress lies an extraordinary contribution of heroic polio workers, the majority of whom are women. From global leaders, national leaders, advocates, fundraisers, vaccination community workers, campaign managers and scientists, to disease surveillance officers and local community officers who are building trust in vaccines at the local level. The commitment and the diligence of these women enable us to vaccinate over 400 million children every year. For example, Nigeria's 20,000 strong polio community workers, more than 90% of them are women. playing a critical role in the country being certified wild polio virus free last year. These women work tirelessly in reaching out to mothers and to caregivers in areas where social norms prevented male polio team members from interacting with women in the community. There are similar examples from Pakistan and Afghanistan, where the increase in female polio community workforce has contributed to growing vaccine acceptance in communities. But our work to protect children from polio is not over. Even one child with polio is one too many, so we cannot stop until we end this disease for good. Millions of children missed their polio vaccines in 2020. And COVID-19 pandemic has exacerbated many challenges we face in getting children vaccinated. And this is why earlier this year, UNICEF and partners of the Global Polio Eradication Initiative launched a new strategy to urgently overcome these remaining challenges to polio eradication. As we implement this strategy, we must remain committed to advancing gender equality. Our work should empower women across all levels of the global polio eradication effort, from decision makers to frontline workers. UNICEF is grateful to national governments and global donors and partners for your unwavering commitment to gender equality and to global polio eradication efforts. We also count on your continued leadership and support in overcoming the remaining hurdles towards achieving a polio-free world for every girl and every boy. I look forward to our dialogue today with colleagues and partners and experts from across the world. It is an important opportunity for us to discuss how best to address safety and other challenges that are facing female polio workers in the final frontiers of the polio eradication effort. So thank you, and back to you, Geeta.
Thank you, Edie, for those remarks. We will now hear from two committed members of the UNICEF team, Julie Hackett, Program Specialist, and Jennifer Gatto, Program Officer. Both Jen and Julie have been serving as UNICEF's gender focal points for the polio team since 2019 and continue to do that work to advance gender equality in GPEI. Take it away, Jen and Julie, go ahead.
Sorry, I had my mute button on. Hello, everyone. I'm Julie Hackett. Welcome. Today, we have convened a group of advocates, experts, and activists who are passionate about and dedicated to advancing gender equality in public health and polio eradication. We are here to recognize and honor the heroic efforts of thousands of women across the world in the fight against polio. Women everywhere have been knocking on doors, delivering vaccines, creating policy, raising funds, conducting surveillance, and most importantly, entering countless homes and spaces to vaccinate over 400 million children each year. They continue to build trust and relationships in communities and to push all of the necessary buttons to keep this program operating at such an intense momentum. These women are tireless, they are fearless, and without them, the remarkable progress over the years to eradicate polio would simply not have been possible.
Hi everyone, I'm Jennifer Gatto. As many of you know, life for some women can be extremely challenging, as strict social norms and other barriers prevent them from moving freely and safely, even in their own communities. And despite the evidence that we have about the pivotal role of female frontline health workers in vaccinating children, they are still not evenly integrated into health systems and communities. So today we are here to dialogue and ask the difficult questions of what it will take to advance gender equality, what it will take to get these women who have worked to eradicate polio for so long recognized by their health systems. How do we protect them? And how do we create a healthy and productive future for women and girls who are born into such challenges? To the loyal and steadfast donors to the Polio Eradication Initiative, this progress also would not have been remotely possible without you. We thank you. We are so grateful for your support and your dedication to advancing gender equality as a part of your central work around the world. UNICEF and our partners firmly believe that in order to truly achieve gender equality, women must be empowered and represented at all levels of the program, and that this is a critical part of eradicating polio for good.
Choose any day of the week, and you will find a woman somewhere in the world working to eradicate polio. Wherever she is part of something historical and life-saving. So now we are pleased to take you on a virtual trip around the world to meet some of these amazing women. First, we will go to Geneva to meet Heather Monet, who works to mobilize the much-needed resources to eradicate polio. Then over to Copenhagen to hear from Ann Ottesen, who makes sure that polio vaccines are arriving in a timely and safe manner to over 100 countries each year. After that, we will travel to Pakistan to meet student artists at the University of Balochistan. And then finally, we will meet Miriam Jallo, a volunteer community mobilizer who played a major role in helping Nigeria to be declared free of the wild polio virus in 2020. Thank you once again for being here with us, and we truly hope that you enjoy the journey. Over to you, Heather.
Thank you, Julie. Good day, everyone. I'm pleased to be joining you all from Geneva, Switzerland. I'm an external relations officer at the World Health Organization working on polio for over 15 years. I am passionate about achieving eradication, but I'm even more passionate about gender and the critical role that women have played and are playing to eradicate polio. And while I'm passionate about gender, I'm not a gender expert. It's the women and men who work in the communities who look at the basic challenges through gender glasses, who are the true gender experts. Why are boys not being reached by vaccination teams in some communities? Are fewer girls being reported to have polio? If we had a woman's perspective on what time of day is safer for women vaccinators to be in a particular neighborhood, would that make a difference to how many children we can vaccinate? These are the crucial questions that we all must continue to ask. A few years ago, the GPI reached a point where it seemed like we had turned nearly every stone to end polio, and yet we had not defeated the disease. Acknowledging that gender is a powerful determinant of health outcomes, that's when we started wearing those gender glasses, and the GPI adopted a formal gender equality strategy in 2019. This was a significant turning point in the way we began to look at the role of women in our program, and also what brings us together today. Most healthcare is delivered by women, but the systems to deliver it are designed by men. When we deliver vaccines from house to house, shouldn't we consider that women might prefer to take a route which gives them better personal security? Do we ensure that there are safe bathrooms available for women to use during long campaign days? And are there enough female supervisors available for women who may not feel comfortable speaking about the issues to a male supervisor? Again, these are the questions we must ask to keep female health workers and caregivers safe. Once we educate people about how gender glasses can make the program more effective, they often have a aha moment. Everyone should have a pair of gender glasses. What we need now is to put time and effort making sure everyone can get a pair and use them. I am so happy to be a part of this event today and so grateful to the women everywhere in the world working to eradicate polio. Thank you.
Hello everyone, my name is Ann Ottesen. I'm very happy to join you for this special event on the role of gender in polio eradication. I'm joining you from UNICEF Supply Division in Copenhagen, from the world's largest humanitarian warehouse. We do not store vaccines here, but other commodities that can be delivered to countries within 48 hours. I'm a senior manager here at the Vaccine Center in UNICEF Supply Division, and I'm leading a team which secures right vaccines at the right time to the right countries to support immunization activities to reach the global targets. For the polio program, we have a unique target. We're aiming to eradicate polio over the next few years, the second global disease after smallpox. And obviously that comes with a lot of challenges, not least from the global supply management perspective. Every year, UNICEF delivers over 2 billion doses of vaccines to 100 countries, protecting children against deadly diseases. And we're reaching around 45% of the world's children below 5 years of age. Polio vaccines makes up the largest quantities, and over the last 5 years, we procured more than 6 billion doses of polio vaccine for routine campaigns, preventative campaigns, and outbreak response. As a humanitarian professional, having dedicated my career to secure vaccines to children across the globe, I do believe that gender equality and empowerment of women at all levels of the immunization program are yet to be fully leveraged to reach every child with life-saving vaccines. We are still missing children out there. Women are already contributing to drive progress in many aspects of the polio program, from political advocacy, community engagement, campaign planning and implementation, but also in supply chains in countries and through their roles in governments and vaccine manufacturers, not least. On the ground, for the last mile, women play a key role in building trust in communities and accessing and immunizing children in healthcare facilities and in the families, not just for polio, but for all other vaccines in the expanded program on immunization. The role can be further leveraged in disease surveillance, and women can play a more prominent role in outbreak response, in oversight, management, supervision, and in delivery of the vaccines. If we're ever to achieve the goal of global eradication, the momentum must continue and be further expanded. Women can contribute more if they're allowed to. We need increased empowerment and participation of women at every level, in every institution, community, and household. Thank you very much.
Assalamu alaikum. I am Sherali from Fine Art Department, 8th semester.
I am Tanil Zafar from Fine Arts, 2nd semester.
And I am Nufakma from Fine Arts, also from 2nd semester. We are all from BUITEMS University representing on the World Polio Day and talking about how polio is a change or is a huge aspect in our life which has flung over or not being seen by the people in this country. Polio as a disease causes irreversible damage in a child's life, and we, in order to eradicate it, there is a vaccine which is being provided by the people called the polio workers. The painting behind me was made by one of my fellow artists from Balochistan University, which got the first prize among a competition which was held between universities of Balochistan. The fellow artists are trying to show how the people in this profession are being murdered and not being taken seriously about their jobs and about what they do as a noble thing. The thing is that this vaccine has a myth around it that it contains some kind of drug which is not good for our children, which is not good for the next generation. So that's why the common misconception in one's mind that we don't want this vaccine to be in our child's body. So that's why they take out their anger on the noble and poor polio workers, as the myth has flown around that it has some kind of dangerous thing in it. So that's why the polio workers are even shoved off at the gates. One of the polio worker that I saw on TV who got martyred, baby Sakina with her daughter, was on duty working, and in this far-flung area she was trying her best to give the future, to make the future for our children bright and happy without the uncrippling damage which can be caused by polio, but she was martyred, she was killed. This profession is such a noble thing. We don't give them a lot of value or honor. We should provide them with social security, give them allegiance, increase their pay so that they could work more dedicatedly in this profession. As the people are still trying their lives off, giving, like they're always working on the edge, trying to eradicate this virus from life, so that the country of Pakistan could have a brighter future and the future generation could live their life successfully and peacefully.
Our kids should play around, not sit on wheelchairs.
And looking at the world hopelessly.
They should run, live, and laugh as the normal child has, have all the opportunity as a normal child has. Thank you so much for giving us the opportunity to speak on this important day on a noble profession, and we are very, very thankful and grateful. Allah Hafiz.
Hello, everyone. My name is Mariam. I'm speaking to you from Kano State, Nigeria. Here we are in the middle of a health awareness session with VCMs and mothers. Mothers, could you say hi? Hi. VCMs, could you say hi? Hi. You have something to say?
We are glad to be part of this occasion.
They are glad to be part of this event. Okay. Last year, Nigeria joined the African region to become free from World Polio virus. Much credit to this success goes to our 20,000 volunteer community mobilizers, over 90% of whom are women. It's not an easy job to become a VCM. You need to be strong and brave to work house to house, almost every day, sometimes in an insecure, sometimes unsafe areas. You need to be patient, because we are patient. So we need to be more patient to listen to all concerns of parents. We need to be credible so that the parents trust us when we provide them with life-saving information. We need to be persistent and committed to keep engaging the community to address rumors, myths on polio and other vaccines. I can remember the most trust that the BCM gained from the mothers is that the communities here, when a mother delivered or a woman delivered a child, she wouldn't be able to go out sometimes till after 7 days and sometimes 40 days. That's a tradition. So the BCM is allowed to take the baby to the nearest health facility for polio vaccine and for polio 0 dose and other vaccines. So this is a huge, it's kudos to the BCMs, because it's a success that they gain. The mother can give out her newborn to a VCM just to go and vaccinate and come back. The role of women in communities in Nigeria are very, very critical, whereby social norms allow only women health workers to enter households, especially when there are no male present. We face a lot of challenges. Sometimes if you go to houses during polio campaign, you will face a lot. They would say, you are women. We don't talk to women. Don't come to our house. Even being women sometimes. And you can find the mother is ready for the polio vaccine, but she will tell you that I can't say anything. I don't have say. The child belongs to the father. It's only the father that has say. Sometimes the uncle. Sometimes, even the mother-in-law has the say. So we face these kind of challenges, but our work does not stop. We still ensure that all children receive polio and other vaccines to keep them healthy and strong. On behalf of the BCM, on behalf of the health workers in Nigeria and global, let me conclude by saying we are determined to keep fighting to stop all types of polio, virus, and other deadly diseases in Nigeria. But we do need support from you. We need support for adequate safety measures that allow women to focus on their work without fear. We need equitable access to job and training opportunities, and for policies and law that empowers working women and that enable them to achieve their potential. Thank you for listening. Thank you very much.
Thank you so much. That was extraordinary. That was really inspiring to hear those stories. So you met some of the true heroes. These are the invisible heroes behind this effort, and they truly deserve our applause. You can see the diversity of women that are involved. You can see the innovative ways in which people are getting engaged in this tremendous effort. So thank you to all of you for your bravery and for your dedication, even if you are just making sure the supplies get there on time or advancing understanding of the concept of why gender equality is so important in polio eradication. All of it is important. So thank you so, so much. Let's turn now to our panel. I'd like to introduce our panelists. And I would like to begin with Dr. Rahila Umer Sumalani, who you saw some of her work on the screen right now, where she's bringing students together through art. Dr. Umer is the Dean of the Faculty of Social Sciences in Balochistan University of Information Technology, Engineering and Management Sciences in Quetta, Pakistan. She has been with the university since 2004 in various capacities, serving as a lecturer, head of the Computer Science Department, and currently as Dean of the Faculty of Social Sciences. Dr. Umer has contributed to several journals and publications on issues such as women's empowerment, social media and e-governance, and on information technology and online education, all extremely relevant and timely issues. And over the years, she has been working really closely with the Polio Emergency Operations Center in Quetta, facilitating events and platforms to engage university students in supporting advocacy and building trust in polio eradication. Next, I'd like to introduce Dr. Tunji Funsho, who's chair of Rotary's Nigeria Polio Plus Committee. He leads Rotary's polio eradication efforts in Nigeria. In 2020, Dr. Funsho was named one of Time magazine's 100 most influential people in the world for his work in eradicating wild polio in Africa. Congratulations, Dr. Funsho. Dr. Funsho is a cardiologist based in Lagos, Nigeria, and has been a Rotary member since 1985. He has been Rotary's National Polio Plus Chair of Nigeria since 2013, and in that role, he has also worked closely with the Global Polio Eradication Initiative, partner organizations that include the World Health Organization, UNICEF, of course, the US Centers for Disease Control and Prevention, the Bill and Melinda Gates Foundation, and Gavi, the Vaccine Alliance. So as a member of the Presidential Task Force on Polio, Dr. Funsho also works with Nigeria's Minister of State for Health, the Interagency Coordination Committee for Polio Eradication, and much more. Thank you, Dr. Funsho, for your efforts. Next, we have Sahar Hegazi, who's a Senior Communication for Development Specialist with the UNICEF Regional Office for South Asia, but currently posted in Amman. In her current role, she's leading the social and behavior change area of work of the Global Polio Eradication Initiative Hub in support of Pakistan and Afghanistan. Sahar's professional experience extends over 20 years for areas such as gender, policy advocacy, program coordination, and public partnership. Prior to joining UNICEF, she worked and led teams for USAID-supported projects in Population Council and also worked in UNDP, and she's worked in Africa, Middle East, and Asia. Welcome, Sahar. And finally, we have Dr. Anita Zaidi, who's president of Gender Equality, is also director of Vaccine Development and Surveillance, and director of the enteric and diarrheal diseases programs. She wears many hats. We're proud to have her as president of the Foundation's Gender Equality Division. In that role, she oversees the Foundation's efforts to achieve gender equality by integrating gender across the Foundation's global development work and investing in women's economic empowerment, women's leadership, and removing barriers for women and girls to thrive. Anita also serves as the Foundation's director of the Vaccine Development, Surveillance, and Enteric and Diarrheal Diseases programs. And since joining the Foundation, I think you joined in 2014, she has led a team focused on vaccine development for people in the poorest parts of the world and on surveillance to identify and address causes of death in children in the most underserved areas. So as you can see, we have quite the lineup here of experts and advocates and activists and academics. So welcome to all of you. You have all come together. Thank you for sharing your expertise and your personal experience, and to help us make some recommendations on how GPEI, as well as the public health community and the donors who support this effort, can empower, engage, and elevate one of the most important and valuable resources it has, which is female frontline workers. We're going to keep this conversation informal, so excuse me if I use only your first names. And my first question goes to Sahar. Sahar, what value, can you explain to the audience here for a minute, what value could addressing gender differences and inequalities bring to the quality of polio vaccination delivery?
Thank you very much, Geeta. I'd like to borrow the excellent point that came from Heather, talking about how gender is one of the most powerful determinants for health-seeking behavior. And if we take that as a motto and look at how it could help to really bridge some of the issues like achieving coverage of persistently missed children, if we only apply a gender lens on all our polio eradication campaigns, we could definitely go a long way. Let me give you a few examples here. Before every campaign, we always plan by looking at the data. So if we go a little bit further and make sure that the data we review is segregated by boys and girls, just that we know, are we missing more boys or more girls? And what is the reason there? Is it a matter of some preference or discrimination or inequality for the girls? And that would definitely help us, not for just review of data, but be able to design our campaigns better. We heard from Miriam that she said, moms don't always, unlike what we think, are not always the decision makers. So do we know who's the decision maker? It may not be even in the whole community, in the whole household. It could be in the community, like a religious leader or a traditional healer. And hence, do we really, using this approach and gender lens, tweak many of the minute details in every campaign? Hence, we would increase the chance that the door is open and the child is presented to us instead of being refused or just being, as we say, NA, not available, as one of the excuses for pushing out. So in summary, I think, Geeta, if we really apply a gender lens across different phases of our campaigns, from planning to implementation to monitoring afterwards to improve how do we go in the following campaigns, we definitely would increase our chances to reach all the intended children. Thank you very much.
Yeah, I think you explained that really well, Sahar, that there are existing norms in every society of how the roles of women and men, and that affects even something like the delivery of polio, the acceptance of a polio vaccine. So thanks for that. Tunji, let me turn to you to ask you to give us some examples of what you've seen in terms of how gender barriers have been overcome in Nigeria, particularly in looking at the way in which women's voices have been amplified and how they have led change in Nigeria.
Thank you very much, Geeta. And thank you, UNICEF, for giving me an opportunity to be on this platform, which I think is one of the important ways we can actually, break those barriers we're talking about. I believe that there are three elements to overcome gender barriers. One is to ensure that the girl child has a role model, someone who has broken the barrier that they can look up to know that I too can do it. And we have quite a few in Nigeria. We have Deputy Secretary General Mariam in the United Nations. We have Okonjo Iweala in WTO, and we have some local champions who are CEOs of banks in this country, and also political leaders in their own rights. So role models are very important in breaking barriers. Of course, the other one, which we don't have in the numbers we need, is education. There's a need to ensure that we have policies and we put resources to those policies to ensure that every girl child has an opportunity to be educated. And if there are cultural barriers against that, we need to use our traditional leaders and our religious leaders, advocate to them to ensure that the girl child is educated. I know both predominant religions in Nigeria encourage girl child education. So that will not be a very difficult thing to overcome. Of course, the other major one is political. There has to be a political will on the part, of government for inclusion, of women in the political process. I know that some of the parties have 35%, for instance, is enshrined in their constitution, but actually to put it into action has always been the problem. So those are the three elements. And I think by and large, the first one, role models, we have enough of them. But opportunity for education for the girl child is not as good as it should be. And I think more advocacy is very important, particularly to the political leaders and traditional leaders. And of course, mention, the role of politics and ensuring that, women have a foot in the door and are given the opportunities to reach their potential. Because really, not talking just about polio, talking about all aspects of human development. Mm-hmm. If we not use 52% of the resources we have in the world, to assist us in solving problems, then we are missing a big chunk of the potential that we have as a world population.
Thank you. Thank you. You're absolutely right that the investments we make in closing gender gaps, in promoting gender equality overall, also helps the polio eradication efforts. So thank you for making that link. Let's turn now to Pakistan, Rahila. And can you share with us, because I know the data shows overall that we're making progress in reaching missed children who haven't been reached with the polio vaccine, and we made progress in reducing refusals in Pakistan. But I know that in some high-risk places, we are still missing many children. So is there any innovation that comes to mind that we haven't tried yet, or where that will enable women to play a key role in getting to those places where the virus is still persisting, to enable them to reach zero-dose families?
Thank you so much, Geeta. Thanks, UNICEF, for having me to contribute in this noble cause. Before answering your question, I wanted to go to the causes. What are the major reasons that still we can't get rid of the polio virus? So there are three major reasons. First is the misconception of the people about the polio virus. Second is the insecurity within the country. And third is the poor health system. Now, where the UNICEF can help is in the first part, which is the misconception of the people about the vaccine. And definitely the second reason is about the insecurity within the country, and poor health system is all about the finances, which is like, it is insufficient finances always been the major concern. So how can we help the people to address their concerns? So the innovative thing, which I think in my point of view is a proper research is to be needed. That should listen to the families and communities who refuse to participate in the polio eradication program, and then strategically address their concerns. The caregivers must be informed, involved, and engaged in the decision making. As we all the panelists agree, that it's just like we can't. Women is playing in a major role in this program. Same as in Pakistan, polio vaccination is heavily influenced by gender dynamics. Therefore, we should involve more women in the program from community level to the decision-making positions and providing them the safe environment to work. And third, I think, is the use of social media. It's the most innovative way that we can use. And as we know, that social media has been responsible for relevant changes in both personal and community health, especially by making it easier for a large number of people to rapidly share information. So I think there must be social media campaigns for the program. And the other thing is that we should use, I'm from computing background, that I think that we should integrate ICT and in this thing. And there should be an intelligent surveillance system who should track the missing children, because the major problem is the missing children, the NA kids. It's one is the cluster of the refusals, and third is the NA children. So there must be an intelligent surveillance system to track those children. So these are I think, in my point of view, these are the things that we should look into for the upcoming future goals.
Thank you, Rahila. Given your expertise, I just want to say, that social media is a double-edged sword, right? So it can sort of spread rumors and misinformation, but it's really is a powerful source to inform people and give them correct information. So I think that's one of the things that we all need to work towards, is to make sure that we can harness the power of social media to spread the right information, and that's critical. Anita, let me turn to you now to ask you from your vantage point. We've heard from the other speakers about how important this issue is to disaggregate data, to involve women, to understand the role that mothers play and their social position in society, etc. But often gender is seen as a side issue across health and global development overall, something that can be addressed later, that's often gets deprioritized. Why do you think that is? And should we be thinking about gender inequality differently to make sure that it's the center of programming, especially in polio eradication? Love to hear your views.
Thank you, Geeta. Thank you for the invitation and also for holding this seminar on the role of women in polio eradication. I don't think that we have done this before. I could be wrong. So unfortunately, you are right. Gender is often seen as a side issue in health and in the whole health and development sector. I mean, polio is not an exception here. I, am of the view, and as I'm sure you've heard from many of your illustrious speakers, you can't really make progress in health and development without keeping gender at the center of our considerations. And polio is by no means an exception. In fact, polio, which is such a heavily reliant program on the frontline workers who are mostly women, has an opportunity to really change the paradigm here for how people think about bringing, I think Heather used the word gender glasses or gender lens to polio eradication. And I think the launch of the GPI gender strategy is an important first step. Gates Foundation is taking important first steps. We just established a new division for gender equality. With the sort of thinking behind that is we want to bring gender to all of our programmatic thinking and make sure that we are thinking about how gender is influencing program success versus failure. How can you thinking about the needs of women? How do you bring women's creativity and ingenuity to the forefront? And how do you think about women's needs? I mean, again, one of the things when you talk to women in the field, their safety issues, their access to restrooms during a hard day's work, these all make a difference to program quality, and we just have not done a good enough job, and that needs to change. I'm happy, I'm happy to see that there is progress, but a lot more needs to be done.
Thank you. Thanks, Anita. Those were really important points you made, and we're thrilled that the Gates Foundation has decided to elevate the issue and create an entire division for this work. I will say to you that, in addition to safety and toilets and so on for frontline women workers, there's also the issue of payment, and career advancement, and how do you make those kinds of frontline community health workers truly benefit from the work that they do that is so essential to our success.
Yeah, I absolutely agree on that, Geeta. I mean, the sort of payment, career progression, all of those things are critical. And maybe I'll come back to that later.
Yeah. Let's then continue to try and make the case for why it's important to shine a light on gender and gender norms in this context. So Sahar, can you share with us an example of what it means to look at an aspect of polio programming through a gender lens? We use this term a lot, apply a gender lens. I loved Heather's put on those gender glasses. But what is an example of that would be compelling to donors in particular?
Geeta, when we were preparing and we talked about an example, and now that I'm going back again, I would always keep saying it, even if that question is asked a million times. It's the frontline workers. Frontline workers are the backbone, are the building block for this program, as well as for any other outreach program. And the reason to put that, even from a pure investment, as a business investment case for any donor, is you are not only investment in the now and the near future, or even the tomorrow, it's the next year and the next decade. Meaning, today we may be resolving an issue about the refusals in a community, but tomorrow you're really building trust, and the day after you're able to deliver something that's much bigger than that. That polio health worker can become actually a whole health, as we say, or a whole child health, as we say, community outreach. And the way to do it, as Miriam has said it, I can't say it any better. It's all the way from knowing what's the ratio, males and females among our health frontline workers. Are they well distributed in the places where we need them to be? Are they hence well recruited, trained, paid, retained? So, and of course, I can't stress more the point that she brought about the security, although we cannot take it only from the security point of view, knowing that there are so many other abuses and assaults that they are facing, not necessarily because of security issues. So how do we provide the protection for them and being able for themselves as well as for the community and the supervisors to know that the program the government honor this cadre of women. And that's how we can really put the model that Dr. Funsho was speaking about. And I would end with one thing. When I was in Kandahar earlier this year, and I asked one of the heroes I would see, who's going around all the streets of Kandahar, why did you choose this very particular job in spite of all the difficulty? And I think the answer summed it all. She said, I wanted my 8-year-old daughter to know, when she sees and know what her mother is doing, to give her the motivation and inspiration to be a lot better than who I am. Mm-hmm. Thank you, Geeta.
That is exactly Tunji's point about the need for role models. But the other point you brought up about safety and security, let me turn to you, Rahila, just to ask you, are there tangible ways in which we can safeguard our female frontline workers and supervisors? Because they often work in very dangerous circumstances.
Thank you, Geeta. Just want to second Sahar that we should note that who are the females who are working in the front line. They're the one who are doing this job because of the poverty and lack of opportunities. These lack of opportunities force them to accept a job with a pay which is under $5 per day. So it's very less pay that they're accepting. And like Sahar said, it's like two kinds of security that we're talking about. One is the one which is like frontline workers are going to the field, to the high risk areas. And the second thing is in the work environment, in the offices where they're working. So we need to take care of these both. So I think in my point of view, first of all, we should take care of the financial security of the workers. We should pay them reasonable wages so that they can survive. And the second thing is that providing them the foolproof security. Up till now in Pakistan, 12 female workers have been martyred by the terrorists. So it has become more like political thing. So we should take care of, like before the campaign start, there should be a foolproof security to them. And we should provide opportunities for their career development. This is also important that, like we said, that we should give them an opportunity for the development, and they should go ahead to, as Mariam was saying, that the females are really, mothers are the one who listen to the females. Mm-hmm. So definitely if the education and their career is not, if we don't give that importance, they are the one who are spreading our words. So that's important. And the fourth and most important thing is providing safe working environment. Mm-hmm. As we know that Pakistan is a patriarchal society, and there, I think Sahar was talking about that little bit, that there are harassment issues, abuse of authority. So there should be a system where female can easily talk to the people if they're facing any harassment and abuse of authority. There should be a system where, and one thing is that there should be more females in the supervisory team. That could help. A female can talk to a female very easily. Mm-hmm. So these are the things that I think we can safeguard our workers.
Well, those are important, because it's not just the insecurity caused by political upheaval. It's also them just being women and out there and exposed to all kinds of violence against them. So Tunji, if I can turn to you, Nigeria very proudly was announced to be polio-free of the wild polio virus. And what are the lessons that you think you can share with us, or maybe one important lesson given the limited time, with our colleagues on the ground in Afghanistan and Pakistan, that Nigeria learned that would be important for them to hear too?
So thank you, Geeta. I just want to, contribute to the issue of bravery. Mariam, mentioned, how brave and how very strong our frontline workers are. We've not mentioned, how brave our mothers, have been. We know from experience that mothers, against all odds, will have their kids, vaccinated, even if their husbands are against it, and just beg us not to, paint the fingers. And all we need to do is to inform, the ward focal person, so that when they're making their reports and independent monitors come around, they're aware that these kids, because of the consequence for such is usually quite high, as some of you may have experienced, when a husband gets irate because his child is immunized against his wish. So we must also put on record the bravery of mothers who, despite all odds and intimidation, allow their kids to be immunized.
Yeah.
Yes, talking about lessons, we can share with Pakistan and Afghanistan. Yes, there's a need for more rewards for our frontline workers. What we have done in the last few years until the pandemic came, is to motivate the frontline workers with awards. We recognize at state level the best performing, the top 20 performing frontline workers, and give them some financial award and a certificate. And then we now pick the top 3 from every state, bring them, to our capital, Abuja, and also recognize them in front of the media, traditional leadership, political leadership, to appreciate the work they have done. That again encourages them to continue doing what they're doing despite the hardships and the various handicaps they face in the course of what they're doing.
Thank you.
That is something that can easily be copied in the short term.
Right. Thanks a lot, Tunji, for that. I'm a little conscious of the clock going down, telling us how little time we have left. But Anita, just to make one final comment, we've made a lot of progress, but the progress is motivating. So we need to be amplifying that, talking about it. How do you measure that progress separate from just counting the number of women in the program? What are good creative ways to talk about that progress?
Geeta, you're right. That's just simply looking at the numbers of women involved in the program is not a good enough metric for gender equality. And we need true representation and empowerment and engagement from women if we are to make real progress in polio eradication. And I want to acknowledge that GPEI has come a long way in integrating a gender equality approach into its programming. But like many other institutions, including us at the Gates Foundation, there is just a lot more that needs to be done. So I'm happy to see how the program is thinking about gender equality. But I would urge the GPEI leadership to listen to the comments that have been made, from Pakistan by Dr. Rahila Umer, and how does one empower decision makers at all levels of the program. All of these are, essential to breaking down the many gender-related barriers that there are to vaccination. And I want to also make the point that for GPEI, there is a need to increase ownership and accountability for gender mainstreaming across the program, including increasing the number of women in senior leadership roles and providing career ladders and pathways to leadership, providing decent work, strengthening data collection, analysis, including social data, right? What are the problems that people are facing in different areas? Who got vaccinated? Who didn't get vaccinated? Who are decision makers? All of those are going to be critical measures, metrics that are going to be needed for program success. In the end, I would just say that women polio workers are the true heroes of eradication.
Thank you. Thank you, Anita. I think these were all incredibly insightful comments. It is a marathon. This has never been a sprint. We know we are here in for the long haul, and we're so close to the finish line that if we can address this issue, the issue of women's empowerment within societies, where women as mothers, as frontline workers can really take charge of this problem, I have no doubt that we'll see the end of polio. So thank you very, very much to all the panelists. I really appreciate your inputs. I hope the audience has enjoyed it as much as I have, this conversation. We're coming close to the end of the program now, but before we do, we're very honored to have with us another gender champion and a key partner of the Global Polio Eradication Initiative, Dr. Rochelle Walensky, who is the director of the US Centers for Disease Control.
I am pleased to be with you today to honor the heroic women who have dedicated themselves to eradicating polio. CDC stands with you in the commitment to removing the obstacles to women's involvement in and ownership of the eradication effort. Women are at the forefront of the global struggle against polio. As caregivers, as vaccinators, as vaccine advocates and trusted leaders, as scientists, as public health professionals, and as managers in the Global Polio Eradication Initiative. In Nigeria, volunteer community mobilizers, over 90% of whom are women, helped the country achieve wild polio-free status. Pakistan's community-based volunteer program has significantly decreased the number of Pakistani children who have missed vaccination. About 2/3 of the volunteers are women. In Afghanistan, where strict gender norms have presented enormous challenges, the women of the Immunization Communications Network can enter households where men are not allowed to interact with women alone. Truly, women are a powerful force to build trust, and their impact goes far beyond polio alone. For example, they can educate other women about issues affecting their health and their children's health, like the benefits of exclusive breastfeeding. CDC is committed to helping remove gender-related barriers to polio eradication. That means that our interventions need to identify and overcome gender barriers at all levels. It is not enough to promote gender equality only at the household level if health systems and services are not addressing these barriers. It means that policies and budgets must be aligned so that we may strengthen the resolve to reduce gender inequalities and empower women to be able to do their jobs without fear and with hope for a secure future for themselves and their families. With thanks to donors for the support and push to think beyond the traditional polio mandate, the program now has dedicated funding to support gender mainstreaming activities for the 2022 to 2026 strategy. We asked for renewed commitment from country leaders, global advocates, partners, and donors in supporting GPEI in translating strategies into concrete actions for equitable participation and empowerment of women across all levels in global polio eradication efforts. I am delighted that the Global Polio Eradication Initiative is amplifying its efforts to advance gender equality in the fight against polio. My thanks and CDC's thanks to all here today and to the heroic women across the world who are making great strides in this work. I look forward to seeing the progress as we cross this critical and very close finish line. Now I'll turn the virtual podium back to you, Dr. Rao Gupta.
Thank you, Dr. Walensky. Thank you for your remarks. It's fitting that we end this session with a voice from the field. We will now take you to Afghanistan to hear from UNICEF's Gender Program Specialist, Veronica Kamanga Njoko. Over to you.
Gender parity in the engagement of female frontline workers is critical in eliminating inequities of health outcomes in Afghanistan. Over half of UNICEF-assisted frontline cadres, especially those working in communities and directly with families, are females. In Afghanistan, with a conservative culture, within the communities is mostly females who have access to households or homes. And this is evidenced during the house-to-house intervention, such as polio vaccination, maternal and newborn community awareness. These female cadres have a unique opportunity of identifying newborns and sick children in the homes who would not have been seen or received the services had it not been female health workers were there to visit them within their homes and refer them to health facilities for further care. And as you might have been aware, there is a polio campaign which will be coming up soon in November. Therefore, lack of participation of females will directly jeopardize the gains that we've already made in terms of universal access to polio vaccine in Afghanistan context. To give you an example, just in July 2021, female frontline workers provided health education and referrals to over 30,000 children and women for services at health facilities, with 75% of these referrals receiving appropriate care. And just recently in September, when over 50% of these frontline workers had limited access to community, we saw 1,000 children and women only who were referred, which represented a miserable 3% of what was achieved just in July 2021. Therefore, I cannot overemphasize the importance of participation of female frontline workers, particularly in polio vaccination and its campaign thereafter, as this is critical to make sure that we are able to invest in having more female cadres, including their safety as they are doing their job, because lack of their safety greatly contributes to low participation of these female frontline workers in polio campaign.
Thank you so much, Veronica. And thank you to all of you for joining us today. I hope you were inspired by the many stories we heard about the individuals at the front line, the individuals within health systems, within organizations, the donors, all of the players who are involved in this massive effort. We're so close to the finish line. Nothing would please me more, I have to say, than to see us get there. So, and the way to do that is really to sort of place women at the center of our efforts from now on going forward. So onward and upward is what I say. More power to all of you. Let's make it happen. Let's advance gender equality and eradicate polio. Thank you. Thank you to all of you for joining us.
Thank you.